So what is neuropathy and what is diabetic neuropathy? And why does it even matter? Well, really it matters because it impacts quality of life to a massive degree. So we're going to talk about that a little bit. We'll talk about how nerves work a little bit. We've talked about that more extensively in other talks. Some treatment options. So there's surgical options, there's non-surgical options. Obviously I do both because I'm a surgeon. Non-surgical is traditionally the vast majority of people in how they're treated, but surgical options are starting to show a lot more promise, and probably we should be a bit more aggressive in how we indicate to treat neuropathy surgically, and I'll explain what I'm talking about later. There's some minimally invasive surgical options, some less minimally invasive ones, and then of course natural treatments, which are always the best if at all possible to include prevention. And of course that's going to include diet, lifestyle, and supplements. So these are people that feel shock, you feel really cold or painfully cold, there's tingling or electrical sensations or like ants crawling under your skin, burning pain, I hear that a lot, pins and needles. These are the kind of words I hear of people that have diabetic neuropathy with pain. Now remember, some people can be neuropathic and have no ability to sense and no normal nerve function, but they may not have pain. Some people are unfortunate and have both, and that's about 50% of neuropaths. Excuse me. All right, so there is a marked decline in quality of life, and in all of our literature, that's always abbreviated QOL. So a decline in quality of life across multiple domains. Domains is just different aspects of your life. There's some emotional reactions people have, so people will get depressed. There's lack of energy or loss of energy or fatigue. Pardon the new dog, sorry. There's pain, which we talked about, that doesn't affect everybody, but affects some people. And then, of course, one of the biggest problems with diabetic neuropathy is a loss of mobility, a loss of physical mobility. So this includes weakness, I think, and fatigue, but also a very dangerous and frightening loss of balance and position sense that happens. And then, of course, diabetic neuropathy will mess with people's sleep because some people will get periodic movement disorder, otherwise known as restless leg syndrome, or they'll just wake up with kind of neuropathic pain.